As a nurse, you're a fixer. As a mother, you fix things. And there was no fixing this.
It's tough to relive it. It's tough to go back through it each time that you discuss it. It bears your soul a little more. It brings some emotions that, you thought you managed through.
The confusion, the stress, the deaths.
The unknown was overwhelming.
Shock and disbelief.
I was surprised.
Confusion.
Sadness.
Wanting information that just wasn't available.
Faithful.
Never in my life would I've ever expected to go through something like this.
What was going to be the historical record and the ultimate future of Luthercare coming out of this.
Well, I remember reading about the virus a little bit, I guess it was after the new year.
I'd even say January as when my first recollection of COVID and certainly the seriousness that it posed.
Many of us watched from afar as this unfolded, trying to gauge, is this a serious threat? Will this be isolated? Will it make its way to America?
First cases out in Washington, New York City, and just at that point getting prepared for, what if something like that could happen in Pennsylvania? What if something like that could happen at Luthercare?
Once we saw the experience with the retirement community in Washington State, that was kind of a DEFCON bell.
I remember I was down at the shore that weekend and read that article and I thought, uh-oh, this is not good.
When you wake up in the morning, God willing that you wake up, right? God willing and the creek don't rise, and you get to come to work, it could be completely different from the day that you were there the day before.
So we had to adapt. And so already now we're scheduling meetings to take what was our original pandemic plans and now lay in the lessons learned and say, well, where do we need to be more nimble?
You can't be compassionate and be rigid. You can't have a learning environment and be rigid. Teamwork is the ultimate flexibility.
Our child care centers closed, and that was one issue that we had to deal with, but those who wanted to help, those child care folks came and they were housekeepers, they were screening at the screening table, they were cleaning high-touch areas.
We had individuals working different shifts than what they normally work. We had therapeutic recreation staff that have nurse aid certification working as nurse aides.
It's just that constant reminder, hey, we have to look at things differently. How can we accomplish the same thing that we always did previously, but in a different way?
Our emergency preparedness in the past had to do with power outages, snowstorms, flooding. So when we rolled out our pandemic response plan in March 3rd, it was geared to be primarily that same kind of let's check the box, let's go through and make sure we're hitting all these areas, everybody's aware of it. And then you have something that blows away the plan.
We already had policies and procedures in place that we had been talking about for weeks at that point, and I really think that helped mitigate the spread.
I think in Fridays, right? So Friday the 13th, Governor Wolf says we're shutting down child care centers.
But it just felt like life stopped in a lot of ways. School buses weren't running. A lot of people weren't going to work. So that I think was one of the strangest things.
When we initially started our no visitation policy, which was around mid-March, I think that's when it probably hit home harder. What we're doing here is just affecting Luther Acres, but it's affecting everyone.
Just knowing that my behavior can impact other people in a very significant way, obviously has heightened who I spend time with, where I go.
From a simple grocery store trip to the mall or vacations.
What can I do to help mitigate this virus? What can I do to help keep another vulnerable person safe?
We have a hero's pledge with our Luther Acres team members, pretty much saying, you know, when you're out and about in the world, please remember that you still come here to take care of our most dependent and most, frail.
And it's just that constant reminder, hey, we have a higher duty here because of our calling and the population that we're working with, that we've got to be more careful.
In having conversation with residents who live independently on our campus, in cottages or apartments and that sort of thing, I see a level of frustration or exhaustion with the situation, but recognizing the importance of being diligent and careful and doing all they can to play their part to make this a safe place.
We are a community. We care about each other just as much as we care about our own loved ones at home. We don't want to see anything happen to our family at work.
So that caution, I think, will be with myself and others for a while.
We were having good results. We had no positive cases. We had no employees who were screened out with our screening process. And then April came around.
And just like that, it came through the doors.
We believe that we had a nursing assistant who was on light duty at the time, so coming back from a workplace injury, and was doing some modified work, and she would have been an asymptomatic positive case back before we were aware of the ramifications of asymptomatic positive cases.
And once it arrived, it seemed to spread so quickly within days that we were hearing of more and more positive cases or presumed positive cases.
It started to impact our staff. We had direct care staff who were part of teams that provided care to our positive residents. They started to develop symptoms and they started to test positive.
And then for several weeks after, we lost residents and
Of the 29 folks that had passed away, 6 of them were already on hospice without having coronavirus. All 29 had a do not resuscitate order, so they did not want any heroics in their care. 21 of the 29 further did not want to be hospitalized. And so when you get to that point, we're really limited on treatment options that we can provide when the coronavirus started bubbling up. The other variable that is a testament to the care at Luther Acres is that for us, that percentage of our population over 85 was 77%. That compared with a state average of 40% and a national average of 34%. And so you take a do not resuscitate coupled with a do not hospitalized, coupled with some on hospice, and you add an age characteristic coupled with comorbidities.
It doesn't take much to push that to the end.
I knew some of the people that had died in addition to my wife. And most of these people were, first of all, very elderly, and second of all, very tenuous as far as health situation was concerned.
I think how quickly it all happened caught us all off guard a bit. It was just a very short window when we lost everyone. Hard to process, sometimes one death at a time, but to have so many so quickly, it was hard.
Accepting that we don't have control over everything. Accepting the fact that we have to be flexible.
Accepting death is very difficult. Accepting death when it's not anticipated is even harder.
I don't think that I don't think I can ever say, at least not at this point in time, that I've accepted the end result of this pandemic. But I think I can definitely say that I've accepted the role as a leader and the focus and energy regarding future preparation need.
And certainly that'll be our driver to make sure that, it happened to you once, it catches you off guard. Ideally, you don't get caught off guard twice.
By May, early May, is when we started to be approached by various news outlets because they had by now heard about the outbreak and the deaths had been reported.
So our numbers were starting to creep up. There's nothing that we could do to stop how we needed to report that, because that wouldn't have been right. It had to be what it was, so people families could understand, the public could understand that no matter what, we were honest in what we reported, how we did it, and what we were doing to make sure it was minimized or never happening again.
Some of the media was very understanding that how we were doing everything we could, but some were not.
We knew what was going on, and we did as much as we could within our confines to say, hey, this is Luther Acres. It is a community that takes care of us. And we always tried to be a witness to that we knew that they were taking good care of us.
All we ask for is balance. That's all we can ever ask for in the media. We don't, we make our mistakes, we learn from them. All the stories can't always be wonderful, happy endings, but at least take the time to hear multiple perspectives and provide accurate information.
I think the importance of having honest and open dialogue with everyone, residents, families, employees, our community, our volunteers, has taken on significant importance.
We have all kinds of things that we have to report. There's many ways to slice and dice numbers, but you don't have to have a good memory if you're honest about what's happened to you.
Good, bad, whatever it was, we needed to document it, we needed to own it, we needed to fix it, or we needed to lift it up.
Keeping people informed has so much to do with how they then feel in terms of their own safety and also in terms of their responsibility.
I don't get the sense that things are hidden from us. And that came through very much during the post that they did weekly as to the situation here during COVID.
The Facebook posting that they had, I believe it came out every Thursday, was incredible. I mean, it broke it down. It let the community know what was going on to ease their fears.
Transparency is extremely important. But again, also getting the correct information out so people can interpret what your transparency information is.
You can never over-communicate. That is the biggest lesson.
And I think going forward, transparency is going to be expected because we will most likely be going through this again. Our families were wonderful and very patient through all this, but their level of expectation is going to definitely go up.
You could have a wonderful reputation. People don't think they can trust what's coming out of you and that you're not being truthful, no matter how bad it is. Then all that goes away.
Even after we had gone through all of what we were experiencing in the month of April, the campus here was so supportive of the health center.
One of the campus residents here, Mary Ann we'd taken care of her husband before he passed away, and she wanted to give back and wanted to show the staff appreciation. So she kind of organized a rally, if you will.
We organized that in 24 hours by contacting my neighbors, contacting a resident in each of the areas in this community.
140 residents, they got to come between the change of shifts. So we caught first shift leaving and we got second shift coming in. So they showed up, they wore masks, they socially distanced.
I didn't have any bells to ring, but I took 2 old spoons from the cupboard and...
I could drum with one hand and ring the bell with the other.
I just know how important it was, not only to the staff, but to the residents to be together and do something socially.
We were able to see residents for the first time in weeks, and that brought, honestly, tears to my eyes to be able to see the support that they were giving to our frontline workers.
And these were people who may have had loved ones dying or sick inside, and they were cheering the caregivers. They couldn't get in to see them. They had to restrict it. You know, they could see them through the windows, they could talk to them maybe over phone, and they came out in our darkest time and theirs to show support for the people that were giving the care.
You know, they deserve everything and more than what they've been given.
It was just some small something we could do.
It was beautiful. It was uplifting.
When the staff came in on the floor, they were just overjoyed. They felt appreciated.
That caring piece is what got you through. It got you through to the next event, the next resident passing, the next team member, nurse aide, nurse that needed a shoulder to cry on.
So technology is just expanding by leaps and bounds in our industry.
There's a combination of medical technology as well as communications technology that we have to take a good, strong look at.
Telemedicine. We talked about that prior to COVID and the pandemic, and that was something that we were going to grow in the healthcare industry with, and we were using that very frequently during COVID, and it didn't take near the amount of time that we anticipated to make sure we knew how to use it and to use it effectively.
With a little bit of retooling of our thinking, it's a real easy way to connect family members who aren't close by or even are close by and unable to visit for whatever reason.
Some people just needed to connect immediately to be able to see someone through a window or through video.
They came up with some really amazing ways to touch base with each other and take care of each other too.
So the first thing we did was get together as a group of neighbors and we Zoomed. At first it was so lonely that it was even twice a day that we Zoomed for 40 minutes. And then we eventually got used to it and it went down to once a day. Now we maybe do it once a week.
From a perspective of doing life in a retirement community or a senior living community going forward, I hope that we're able to continue to use technology and worship. I hope that we're able to continue to utilize that to keep families and residents connected.
It is with us to stay now. As families have gotten better at it, we now have families who couldn't visit across the country who are now keeping in touch, and that will be part of going forward, that they will be able to stay more connected to loved ones. So it's been a really good thing.
Towards the end of May and into June, things started to return somewhat to normal.
It was never a question of the care and the people that were here and the pride they took in giving that care. Were they prepared for the pandemic? Mentally, physically, nobody was.
They'd keep saying, hey, good job. We know you're doing the best you can, but it didn't feel that way to me. I felt like you left everyone down.
The wearing of the mask, the social distancing, the personal hygiene, the isolation, all those kind of things are giving us this pause as a chance to regroup and learn what we did right, what we did wrong, what we could improve upon.
We're not resting on our laurels. We're not, declaring victory. We're still very much preparing for what we anticipate to be a challenging wave 2 with the coronavirus coupled with the flu season. And how best do we prepare ourselves, the residents, the staff, so that we can hopefully avoid repeating what we had experienced in the spring.
The phrase, "things will get better, we just don't know when," was spoken often. And we kind of hung on to that.
We were almost kind of breathing a little bit of a sigh of relief that the worst seemed to be behind us, but we were fully aware that the expectation for the fall was not going to be good.
And so we did a number of preparatory things. At that point, the PPE was in good shape. Our protocols were in good shape. Our staff education had come around really well. And then it was just really kind of that waiting game for what happens next.
Come fall, we were very worried about what the holidays were going to hold, and people getting together and what that was going to look at, and the expected surges that were coming, and then balanced with the guilt of it's the holidays. How do you tell people you can't be together? How do you encourage people not to be together?
It was hard. I mean, it was definitely hard. Again, we had to try to get creative to make it meaningful. But no doubt, this was a tough holiday season.
You don't want to say it was a sure thing, but the perfect storm was coming with the holidays and the fatigue of the pandemic and people just desperately wanting to have some normalcy and be with family. And so most residents heeded the warning, but there were still a number of folks that just had said, enough's enough. I want to be with my family, and made some, in this case, reckless decisions that impacted other folks.
As that happened, and there were family gatherings and holiday gatherings and all kinds of things, we predictably saw the increase in community spread.
It hit our personal care. It hit more of our independent living. And just as we had started to vaccinate in our healthcare center, it hit there again. So no part of the campus went untouched.
That kind of presented a unique challenge for us in terms of how to meet the collective needs of all the residents for a multi-site outbreak.
We were better prepared for it, but we were also tired. Staff was tired. Those given the direct care were exhausted already.
While it was difficult and incredibly fatiguing again, it felt like it was something that we were able to manage. And it felt different than the first wave that came through here, a lot different.
And then throw in looking at vaccine quickly approaching and how to tackle that with our staff and our residents, our team members.
Early on, skilled nursing residents and staff were part of the 1A vaccination plan. I'm more comfortable with the fact that the vast majority of the residents within all of Luthercare have been vaccinated.
In skilled nursing, the healthcare center, or personal care, we're in the mid-90s for a percentage. We've contracted with another pharmacy to come out here on a regular basis. Right now it's about every three weeks, and we keep having more and more staff willing to sign up to be vaccinated.
So even though we weren't and still aren't out of the woods yet, knowing that the most vulnerable were finally getting access to something that was going to prevent and protect them was a godsend, an absolute godsend.
The past month, there's been a guarded sense of relief, like, okay, I think we might be coming out of that. And now we're seeing a spike in numbers in the county, in the state, just again on campus.
We kind of stayed in a place where things weren't looking better. They weren't getting better. We thought we might be getting closer to having it be better, and then we didn't.
We think we see the light at the end of this tunnel, and now it's getting a little dimmer. So it's frustrating.
But here we still are, and we're still supporting each other. We are resilient. We need to be grounded. We need to learn and continue supporting our team members and our residents, our family, our extended family, and help them through whatever the next few months brings.
They keep talking about this community of people, this population of people being the most vulnerable. I would say in a lot of ways, they might be the most resilient.
And for the most part, our residents here did a tremendous job of self-discipline, but it didn't surprise me either.
We're taking care of a generation of folks that do sacrifice for the greater good.
This has been hard. People are doing their best. They're staying strong for each other. We have residents staying strong for families. We have families staying strong for residents. They're doing their best to put a good face on, knowing that we're still not sure when this will end for us, when it might resurface.
And it gets to what it means to be community and what it means to be human and how we can better care for each other and maybe less so much about me.
I know, and I've learned that I can rely on our residents here, and I can rely on our other team members, and I know that we'll be able to move forward together.
Some gave more, all gave some. People did the best they could from where they were. Sacrifices were made, and the residents of Luthercare, I know, appreciate it. The senior leadership team appreciates it, and just couldn't be prouder of the dedication of the folks that hung with us through this first part of the journey.
I truly feel that we were 100% prepared with our plan, but I think now moving forward, I think to myself, okay, that's plan A. What's plan B? And what's plan C?
Pandemic plan in the past kind of was something you looked at yearly to review to make sure that it was there. And now it's in my hands daily and in other people's hands daily, and it will continue to be there.
Probably the biggest thing is just continuing to try to stay diligent, to stay careful, and to continue to empower people to do the right thing. Recognizing, though, that we all are really tired. We're all really ready for a new normal again. And I'm not quite sure we've completely defined what that will be at this point.
I'm still trying to figure out what the new normal is. I don't think we will ever go back to life as how it was before.
I think it's going to start with physical contact for people again. I think that's a marker a lot of people are looking for, when I'm able to hug a loved one again.
Well, I hope the normal will be a whole lot like what life was before, but recognizing that it's important to be careful.
As this year was a process, the unraveling from the year and readjusting will be a process too.
There's been times of hope, and then times where it's like, not again, not again.
It has been one heck of a year.
This organization, Luthercare, in the spirit of the church that we're founded on, and that level of service is alive and well and more valid today than it's ever been.
There's always been that hopefulness. Gets back to the phrase we use over and over again. We know it'll get better. We just don't know when.
We can't look behind and say, what if? We have to go forward knowing that we're all in it together.